Hello, everybody, back here for another one. So this lecture covers content from February 7th, Wednesday, going over Dr. Pars's cell injury kind of regulation, necrosis, apoptosis, just mechanics. There wasn't a video for yesterday just because there wasn't any appropriate cards for what was covered. So that is why there won't be any cards for the O&M asthma lecture, the lecture on answering clinical questions, I believe it was called. And then I can't remember the other one, but yeah, that's why there wasn't a video for that. But for today, we'll jump into it. So browse, and then you'll get to your page here with the tags. You're going to be in first aid, but we're going to go into pathology today. We're not going to be in respiratory or any system. So we'll be in pathology. And what you want to do is open up cellular injury. And this is where we're going to be today. It's just cellular injury. You can activate a bunch of cards here. So you can jump into the first one, cellular adaptations and aplasia. You want to get aplasia. Just a single card there. All of the atrophy ones. Dysplasia, none of them. We didn't really talk about dysplasia today, so I wouldn't worry about it. Hyperplasia, all of them. Hypertrophy, all of them. Hypoplasia, get that one. And then metaplasia, there was just a couple of them that I thought were good. So the second and the third, and then the second to last card here. And that is it for cellular adaptations. And then cellular injury, activate all of them. Apoptosis, most of them. So yeah, we'll start in the bottom intrinsic pathway of apoptosis, all of those. And then extrinsic pathway, all of them except the second one. And the reason I did this is if you look at the card, it's different sections that are missing. So I just took out, like, I'm not creating a card to test myself on CD95 as the receptor for FAS-L. I just want to know that FAS-L and tumor necrosis factor alpha cause cell death. So that's it. I don't really care about the receptor, so that's why that one's not activated. And then if we go to basics, all of them except for this one talking about basophilics, that just wasn't mentioned. It was eosinophilic. So there's a card that will be activated somewhere in this mess that's wonky that is eosinophilic, but basophilic wasn't mentioned. And then this one, the 180 base pair fragments of DNA was not mentioned either. Otherwise, everything else there is good. And then we'll go to necrosis. And there's a lot of good ones in necrosis. So all the basics. Caseous is the first three. Coagulative, you want to do the first four, skip one, and then the next four. So the ones I don't have activated is, again, the eosin stain. And then this one, he didn't say it, and I don't know. Yeah, he didn't say it, so I didn't activate it. That caseous necrosis is a combination of coagulative and liquefactive. And then fat necrosis, you want the first one, skip the second, get the last three. Fibrinoid, just the first two. Gangrenous, all of them except the first one. Just because he didn't mention GI tract, so I didn't mention it. He highlighted lower limbs, so that's what I went with. Liquefactive, you want to get the first one, skip two, get the fourth and the fifth, skip one, grab the seventh, or the second from the bottom. And that is it for necrosis. Ischemia, let me fix that. You just want to grab the first one, and then probably would be best come down to the bottom, skip the last one, get the two above it, skip one, and then grab this one. So this one's talking about what ischemia is, and this one's talking about watershed zones. And then these two are talking about how ischemia can occur with interrupted venous drainage and then arterial perfusion. Types of infarctions, we are skipping that. Free radical injury, a lot of good ones here. So if yours is organized like mine, you should be able to just drag and drop here. From the first one, talking about free radicals, talking about the reperfusion injury, but the one you don't want is the Fenton reaction. That wasn't mentioned, but the one after that, yeah, this one's a good one after that. So total brain fart. Skip 3, and then you want to grab this one. The antioxidants help treat free radicals. I feel like that was an easy one to pick up. Come to the bottom, grab the last one, skip one, and then grab these two, which are good and were mentioned. Types of calcifications. You want all of them except these two here, talking about metastatic calcification predominantly occurs in the kidney or the lung, or gastric mucosa. That just wasn't directly mentioned, and I don't feel like it's a high yield. So I wouldn't pick that up now. Lipofuscin, just pick up the first one. That's just helping me know what lipofuscin is, if I'm even saying it right. These are your liver spots. The other ones just I don't feel like are a high yield at the moment. And then amyloidosis. You can open that up, open basics, and just grab the first one. That's all I did, just so I can learn the term, get familiar with it, get it kind of added to my vocabulary. But he didn't go into depth on all of these other types of amyloids. And then, yeah, I would just study his lecture slides, look at his images, and that is it. So that is it for this video. There will likely be more the rest of the week. Hope you find these helpful as always, and happy studying.